As a large public university, we have the mission to serve people of North Carolina. We have one of the largest training programs in the country. And Dr. Karen Dawkins has been the training director for multiple decades, training hundreds upon hundreds of psychiatry residents that are now working across the United States, taking care of patients that suffer with mental illness.
We're great because of the variety of settings. The fact that our residents can follow patients for a longer period of time to hone their outpatient management and their psychotherapy skills because we start outpatient psychiatry in the second year. I think that is also unique to our program. Even at the end of training, no one can ever know everything, but we certainly expose them to enough clinical scenarios for them to be familiar with a lot and have the tools to explore and investigate if they come across something that they haven't seen before.
The faculty at UNC modeled really excellent patient care, both in terms of having a solid knowledge base, but also in terms of really caring for patients and caring what happens to patients. And so because of my training at UNC, I know what high quality eating disorders treatment looks like. I know what high quality peripartum psychiatry care looks like.
The reason the program is so strong is because it has a balanced representation of all the things that I think are important in modern day psychiatry, which is certainly the biological sciences, neuromodulation, all the new things in that regard, TMS and ECT. They have clearly a niche in women's health.
I imagine there are even more now, but at the time there were so many offerings. So, we had the standard things where you had your inpatient rotations and then your outpatient clinic. We did rotations where you were the overnight person. You would come on at like 10 o'clock at night and you would cover the emergency department. And so that really prepares you, right? I left Carolina knowing that I could handle anything.
The passion for excellence and delivering excellent care, doing important scientific work, moving the needle on the educational mission, all those things are absolutely there. What you don't see from the outside is what a family it is in this department.
The people here, I think, are the biggest draw. People like each other here. It's a very collegial environment. When people told me that when I was applying for the job, I thought it was nonsense. It was just marketing. But it turns out that it really is the case that people really like to work together and like each other here. There are lots of places that produce high quality science or are very good at teaching people clinical skills. But there are very few that have excellence in all areas of the discipline and have really nice people.
When I left for the National Health Services Corps as one of the few psychiatrists in this, South Alabama, and, what I really missed and what ultimately brought me back here was the people that I could interact with, but whether it be the residents that we were, helping train, or was the faculty that I needed, advice and mentorship from.
Mental health in general is something that we always have to make sure that we are advocating for the work we do on behalf of our patients, and our trainees get to see that firsthand and also get just an enormous range of experiences that makes this a fantastic place to train.
Many of the people who are here in this department are here because they enjoy being around learners and they enjoy being around atmosphere of inquiry. I think that is the calling card of this department, is wanting to be educators, to train the next generation of psychiatrists, be that for outpatient, community, public sector, or research, as well as taking the best care of patients that they possibly can.
First and foremost, when I think about UNC, I think about the research mentors that really took an interest in my interest in pursuing a career in academic psychiatry and went out of their way to be nurturing and encouraging, to open doors. The other really special characteristic, though, that I appreciated at the time, and I appreciate it even more now, were my fellow residents. What was so great about my cohort, and I think all the cohorts of residents at UNC, is that they come in with diverse interests. And I think all of us became more complete psychiatrists because we had different interests.
I was much more comfortable than some of the season's attendings at the place that I was working, and that was because I was given a lot of responsibility, and we do that a lot, both inpatient-wise and outpatient-wise. So I felt like, I had a variety of experiences, and nothing could be greater than, prescribing clozapine, a medication that we deal with fairly routinely around here. I once, asked at the residency that I was working with, and nobody had, prescribed it or used it.
The other aspect of being at UNC is that it's a great residency. And one of the elements of the residency that I think most impressed by and proud of is the fact that the program is continually reshaped along the lines that the residents suggest. So residents are very active participants in the construction of the residency here. And I think that's one of the reasons that it's so successful and so competitive.
So one of the challenges we're facing in academic medicine is how we have adequate funding for our education mission. And so philanthropy around education is something that really can take what is already a superb training experience and take it to the next level. So one of the things we say to our alumni when they say, how can I help? How can I give back? It really is by supporting our education mission, and through the philanthropy fund to our department, through the Robert Bashford Fund, a beloved faculty member who was so enormously dedicated to education. This funding allows us to have our residents have really unique experiences in a variety of things, in research, in specialty rotations, in global mental health, attending conferences, and doing things that enables them to grow and learn, become nationally prominent, and to be able to really come away from UNC having had a truly superb training experience.
One of the experiences that I had in residency that was pretty foundational was that I participated in a research project with Dr. Meltzer-Brody. I was not somebody who ever saw myself as a researcher, but I did this project with her and saw that I could, and saw that what was possible in research. And so that has given me the confidence to continue pursuing other research projects in my career.
So I've been blessed to be at many outstanding organizations over the course of my career. I have to say the time at Chapel Hill was really very, very special. And it'll always have a special place in my heart because of the foundation that it provided for me, bringing together all the special features of being at Tar Heel.
I feel grateful to the department for what I have received all along, and in a way indebted to the department for the gifts that I've been given and the opportunities. It's been a remarkable career home for me, and I feel very blessed.
Why is this a good time to devote resources to and attention to psychiatry? Because it matters, because this is the quality of people's lives that we're talking about on a huge scale. If you don't have your mental health, you don't have your health, period.
People who are, I think, genuinely committed to serving folks with mental illness, of spreading knowledge, of continuing to improve themselves and each other. And when you're around a high-achieving group, but also a very kind and welcoming and warm group of people, that just inspires you to be better, and it inspires you to feel like this is a great place to be. And for me, that has been the single largest thing that has kept me here through many years. I did my residency training here as well as my entire faculty career.
Was Dr. Dawkins your program director?
She sure was.